How cancer can affect your sexuality and sex life. Cancer can affect your sexuality and sex life in a number of ways. Practical issues, confidence, emotions, and changes in your body can all have an impact. Effects on sexuality and sex life. Not everyone with cancer will have changes in sexual desire or how they feel about themselves sexually. You might not notice any changes at all. But you might find cancer changes your body image affecting the way you feel about yourself and sex. Some people lose interest in sex and feel very tired. But some people say that they want to have sex more than usual. If you are in a relationship, a crisis can sometimes bring couples very close together. As people are so different and have different sexual needs, it is impossible to say exactly how cancer will affect your sexuality and sex life. Some types of cancer and their treatment affect your ability or desire to have sex more than others. If you are in a loving relationship, your concerns may be different from someone who is single. You might not feel like having sex if you have any of these side effects or feelings. Some people say they feel less attractive because of them. You might not have the energy to take as much interest in your clothes, hair, makeup, or grooming as you did before. If you are the partner of someone in this situation, you might be very worried about your partner seeming so low. This is understandable. But many people feel better once their treatment is over, or their symptoms are better controlled. If your feelings about your body and having sex change during your cancer treatment, it doesn't mean that it will last forever. If you are able to talk to your partner, a doctor, or nurses about your worries, it can ease them. They may be able to suggest ways to help improve any problems you're having. Cancer, treatment, and your sex life. Having cancer or its treatment can cause sickness or feeling sick, tiredness, fatigue, or weakness, irritability, sadness, or depression. Anxiety or tension, pain, bowel problems such as diarrhea, bladder problems. Mouth problems, breathing problems, changes in appearance and scarring. Changes in your sex hormones. You might not feel like having sex if you have any of these side effects or feelings. Some people say they feel less attractive because of them. You might not have the energy to take as much interest in your clothes, hair, makeup, or grooming as you did before. If you are the partner of someone in this situation, you might be very worried about your partner seeming so low. This is understandable. But many people feel better once their treatment is over, or their symptoms are better controlled. Painkillers. If you have a lot of pain because of your cancer, it can help to plan for any sexual activity. For example, you could take painkillers 30 to 60 minutes beforehand. Tiredness, fatigue. This might last for some time after your cancer treatment has finished. Many people feel stronger within a couple of months of their treatment. But some people feel washed out for as long as a year, particularly if you have intensive chemotherapy. You might not feel like having sex if you are very tired. Simply touching can help you feel cared for and reduce any anxiety and depression you may have. Alternatives to sex. If you have a partner, you can focus on showing your feelings for one another in other ways by enjoying being close to each other. Touching and stroking, kissing, massaging, talking, holding hands. Even if you do not feel like having sex, a partner might still be able to arouse you and help you enjoy sexual activity. It is important to agree on what is acceptable to each of you. Talk to each other about your worries and fears. Do not be afraid to tell each other what you like and don't like. Talking about sex can be difficult, but talking about feelings and what you each want can be very reassuring.